Hello everybody, we are group 6. We worked on laryngeal implants for vocal cord paralysis. I'm Hannah.
I'm Maddie.
I'm Abigail.
And I'm Lyra. So your vocal folds are located in your larynx, and vocal cord paralysis, VCP, occurs when one or more of these folds are immobilized, failing to move towards the midline. This causes difficulty breathing, speaking, and swallowing, and leaves your lungs unprotected. So the overall prevalence is not recorded, but survey shows that the number of VCP treatments are increasing every year. A common method of treatment is type 1 theraplasty, which uses implants as elastic. But this is an open, invasive procedure and does not successfully close the glottic gap. The most popular method is bulk injection, as it is non-invasive and is a very quick procedure to do. However, current material used are insufficient because they can migrate or they degrade too fast, requiring repeated injections, or some will cause an immune reaction. Our team researched on the most innovative material to provide a long-lasting and biocompatible option for otolaryngologists and patients suffering from VCP.
So there are currently 2 pathways for bulk injections into the vocal cords, through the neck and through the mouth. Through the neck requires that a needle passes through the skin at the neck directly into the vocal cords, and with mouth injection, a needle goes down the throat directly into the vocal cords. Our implant is designed to be usable for both of these approaches. So our team proposes a combined solution of PDMS granules, human collagen 1 solution, and connective tissue growth factors as a bulk injection. The PDMS granules are gel-like, and they will replicate the surrounding lamina-propria tissue. They also will act as a permanent implant. The human collagen 1 solution will coat the PDMS granules and act as a carrying device for the connective tissue growth factor. The connective tissue growth factors are crucial to encourage tissue ingrowth between and around the PDMS granules to keep that implant in place.
So the benefits to our injection are that it addresses some of the problems previously mentioned. It's more biocompatible since it encourages tissue ingrowth, which reduces the risk of a future foreign body response once the collagen degrades. The PDMS can last about 10 years in the body, and the stiffness can be controlled based off of the silicone ratio. The injection is a bulking agent which will close the glottic gap, and the materials are readily available to be purchased. Lastly, the injection is beneficial since it's minimally invasive and requires no anesthesia. The limitations are that the surrounding tissues could be injured from the invasion of a needle, and the recovery time is difficult to predict since it can often vary. There's risk of over-injection also, which results in poor voice quality. The prices of everything are shown here, and the total is much less than the cost of surgery, which is about $2,500. Also, the injectable components don't need to be purchased for every procedure since only about 0.5 milliliter of injection is needed.
So there's quite a bit of competition in this field. Our biggest competitor would be PDMS alone, which is injected as a solid mass instead of granules. The downside to this is that it is not as biocompatible as other solutions, and it usually causes, or there have been case studies of rejection, foreign body response, and extrusion. Botox has also been used. However, it is not effective after 3 to 6 months, and it takes 2 weeks to start working. Autologous fat has also been used. However, it resorbs after 6 to 12 months, and it requires a second procedure and site to harvest the fat from the patient. Teflon has also been used in the past. However, it's been used less due to its cytotoxicity and foreign body response. Radiesse, which is a calcium hydroxyapatite, has been used and is effective. However, the procedure is more invasive, and there has been complications regarding the injection site. It also only lasts about 12 months. Cross-linked collagen microspheres have been used experimentally. However, they are less effective, and they do not last as long as the other solutions. Our approach combines the effectiveness and long-lasting properties of PDMS and the biocompatibility of collagen and growth factor, creating an optimal bulk injection for vocal cord paralysis. Thank you.